Hey guys, it's Shanir again. I'm going to talk to you about supervision again, or about supervision. I apologize for not having this out last night. I had to do a little re-record, had some technical difficulties. All right, so last in the other lecture, I talked to you guys about the vital outcomes and statistics. I told you that I forgot to leave it in there, but I wanted to show you like this is what it looks like. This is just a small portion of it, but it has all the information, number of applicants, students currently enrolled, graduates in the past year. The things you're going to be looking at are going to be the completion rate. So you want that to be at 100% or as close to 100 as possible. Licensure examination pass rate. So are these people prepared to pass their licensure examinations once they graduate? And then job placement rates. Do they go on to get hired? Right. This is the Ole Miss one right here. And this is from 2023, I believe. And then this link here will take you to the full version of this. They have a little bit of other information in there too. But that's what you're going to want to be looking for when you see the vital outcomes and statistics when you're looking at doc programs. All right. So I told you guys we're talking about supervision. So these are the types of supervision. You have individual, which is one-on-one with a licensed supervisor. So that person's going to have an LPCS and be a supervisor, or it can be a doc student in this kind of setting. So like you guys are very likely to have PhD student supervisors while you're in this program. Um, Things that it includes case review, feedback, goal setting, and then discussion of challenges that you guys may come in or run into while you guys are counseling. For a group, it's conducted by a faculty member or a site supervisor, and it's going to be a group of students. I think the ratio I want to say is like 1 to 8 or like 1 to 10 or something like that. But I'm not sure. We'll have to double check on that. But there is a ratio for what that ideally should look like. It focuses on peer feedback, case conceptualization, and professional development. This is one of my favorite forms of supervision just because I get to watch you guys collab, right? So one of you stands up and has a question about a client, and I get to watch the rest of the class um, do a case study on or a case conceptualization on that client. And I enjoy watching you guys get your wheels turning. Then you have triadic supervision, which is one supervisor and two, usually two supervisees. So that's like me and then two students. It encourages collaborative learning and shared reflection between the two. That also works pretty well if you have two clients that are dealing with similar, or two supervisees that have similar clients, going ahead and putting them in the same room to see if they can bounce some ideas off each other while you're also guiding them through this supervision process. Um, 1 second here. Okay, sorry about that. So common supervision activities include reviewing session notes, case reports or recordings, developing treatment plans, case conceptualizations, discussing ethical and multicultural considerations, practicing or role-playing clinical skills, receiving feedback or interpersonal style and therapeutic approaches, setting goals and tracking growth across practicum and internship. So these are the things that you're going to expect to come out of supervision, right? Something that I wanted to add is you guys feel free to come like prepared, right? Like it sounds like a duh, but come with questions. Come with that problem client. Come with the area that you messed up, that you feel like you messed up. Come in the area that you thought that you did well. Bring all of that into the session so that you and your supervisor can sit down and discuss it together. Supervisor and student expectations. The supervisor responsibilities are to provide consistent guidance and feedback, model ethical and culturally competent practice, offer constructive evaluation, student performance, ensure client safety and appropriate interventions, help students manage stress, boundaries, and self-care, monitor progress toward the program and licensure requirements. So these are all the things that the supervisor is going to be doing. The supervisor is really there to help you stay on track and to support you throughout your journey, right? So as you're learning to become a competent counselor, you want your supervisor to be providing all of the necessary tools for you to become successful. Student responsibilities, come prepared. We just discussed this a little bit, but it's very important. It's huge, right? Recordings are going to be big. You guys will be recorded and during your sessions. If you can bring a video in and some, like, hey, around 5 minutes, this is what's going on, bring that in there and talk to your supervisor about that. It'll help a lot. Be open to feedback and willing to make necessary adjustments. So be willing to change your approach as it suits your client's needs. Maintain ethical standards and follow site policies. So that's, follow the rules of the sites and don't do anything unethical. We cause no harm to our clients. Advocate for learning needs and ask for clarification. So this is again coming prepared, right? So advocate for what it is that you need. What is it that you want out of supervision, and tell your supervisor how to provide that for you. If you're confused about something or how to deal with a client or how to deal with anything really related to the counseling realm, ask for clarification, ask those questions. Engage in self-reflection and professional growth. Now, the article that we read was specific to the anxieties experienced during counseling. Client-related themes that popped up were that there was a fear about how to handle new clients, fear of causing harm, and client dropout. The big note here is that everybody's going to be a little anxious, right? These are all concerns that a lot of counselors are going to have coming in, especially when they're new. These are things that sometimes even I worry about still when I counsel, right? But those are the main sources for client-related anxiety. As far as supervisory related, so what does a supervisee feel when it comes to anxiety? Self-doubt, low clinical confidence, but you have to realize that that's going to be normal, right? It's a normal part of where you are right now. Performance anxiety, are you going to meet your own expectations? Probably not, especially not your own this early on, right? Personal issues affecting focus. So that can be like a death in the family or something like that, or just feeling stressed from the school aspect more so than the counseling aspect, but it kind of bleeds over. Ethical responsibility, fearing failure. And I wanted to talk about the fear of failure for a little bit, because the fear of failure, you guys are going to air quote fail, right? You're not going to make every action perfectly. You're going to make some mistakes. You're going to need to tweak things here and there. Embrace that. As long as you're not doing anything unethical, the mistakes can be handled, right? Especially with a supervisor helping you. We can deal with any of the mistakes you bring as long as it's not an ethical dilemma or an ethical issue, right? Something that you did unethically, I should say, because we will help you with ethical dilemmas and such. And then a struggle adapting to the counselor role. What that looks like is a lot of times new counselors come in, and instead of playing the role of a counselor, you play the role of like a best friend with the advice giving and making suggestions and things like that. Supervisor related concerns, negative or corrective feedback. A lot of people don't like to receive negative or corrective feedback, but understand that that's just a part of the growth process, and it falls on your supervisor to be able to relay that information to you effectively. Lack of feedback and guidance. Sorry, and that's just when you feel like you're not getting told a direction to go or pointed in the right direction. Minimal direction during challenging moments, essentially. Yeah. Sources of anxiety continued. Another thing that the article mentioned was group supervision. So what is it about group supervision? It's the peer evaluation, fear of mistakes being seen by others, feeling isolated and lacking experience of other peers. So you may hear your peer say something that you didn't think of, and you start to think poorly about yourself. Understand too that while it might not be the exact same, your clients in group settings are also going to be experiencing these same feelings. So keep that in mind too when you're a group leader and you're trying to get the most out of your group. Individual sessions in general feel safer and less judgmental. Indicators of anxiety. So here are the physical and bodily signs. So shrinking posture, lowered facial expression, fidgeting of hands and gestures, which could also just be neurodivergence. You know what I mean? It's 2025. And then pupil constriction. Verbal and behavioral signs, stuttering, trembling voice, rushed speech, asking repetitive questions, and then silence or withdrawal. Coping strategies, supervisee initiated coping strategies. So self-talk, positive self-talk. So using positive self-talk to replace some of the negative thoughts that you're telling yourself, right? Instead of, oh, you're such a bad counselor, you're so bad at this. It's, I'm a new counselor, I'm working on this, right? Mental distraction, refocusing. So if you're distracted, being able to bring yourself back to center and refocus on what is important. Rewarding yourself after difficult sessions. And you're going to hear this so much throughout the program. Self care, right? Take care of yourself, whatever that looks like. It can look like a bubble bath, playing video games, just taking a break, going on a walk, hike, whatever it is that you do to relax and disconnect. And that's kind of the same thing with the temporary emotional distance is removing yourself from that space and taking some time to work on yourself and then come back, right? Supervisor influence. So these are things a supervisor should be doing, ideally, to help you with your anxiety or to help you not feel anxious. A supportive tone and body language, encouragement. You want them to be encouraging. Normalizing mistakes. That's huge because you're going to make them. You're going to make them. So you want them to be able to normalize those mistakes and not make you feel worse. Addressing emotions openly. You guys are going to have different emotions about different things. They should be able to help you and guide you through those different emotional aspects of the journey, right? Positive and balanced feedback. So you want them to be positive and balanced, like we talked about the positivity, but you want it balanced too. You don't want them always boosting you up and overlooking any of the mistakes that you are making, right? All right. And then finally, we have like some highlights and tips here that I threw in. Remembering anxiety is developmentally normal for novice supervisees. However, it can hinder learning, self-efficacy, and performance if it's unmanaged. So if you're feeling anxious, like reach out to somebody, reach out to your supervisor, reach out to a professor, get in contact with somebody if you're feeling anxious. Clear role induction structure and supervision contracts can reduce uncertainty. Ask about your expectations and lay out yours to your supervisor, right? So ask them what they're expecting of you, but you also have some things that you're expecting from them. There's a certain type of guidance that you want, right? So lay that out with your supervisor. What do you want out of supervision? Because it's your hour, it's your time. Corrective feedback should be paired with support and context. Inadequate supervision increases anxiety and harms growth. So if you're find yourself becoming more anxious, then maybe you're receiving inadequate supervision. And that's something that can be addressed with a conversation with the supervisor, right? Or if you need to go above their head after a conversation with them, there's other people available too in the hierarchy. Supervisors must learn to identify behavioral and nonverbal signs of anxiety, not just supervisors, that's for you guys too, right? For counselors, so that you can identify those same things in your clients. Group supervision may both trigger and relieve anxiety depending on peer support, clarity, and safety. Remember this, and again, remember this applies to your group clients as well. And that sums up this part of the presentation. Again, I apologize for not getting to you guys a little bit sooner there. Thank you.